Hello everyone. Today we will be discussing about faltering growth, its recognition, assessment and management. What is faltering growth? Faltering growth means a child fails to gain weight as expected. It may be due to health problems or social issues. We should recognize it early to prevent long-term developmental and health complications. So, how will you assess a child with faltering growth? What are the indicators? Failure to gain weight, measurements below the third percentile, or dropping 2 major percentiles. See this growth chart. Here you can see the third centile line and the 97th centile line. If a child grows in between these lines, it is normal. Below or above is abnormal. Here the months are plotted. Here on the y-axis, weight is plotted. So when the child comes for follow-up, if the child's growth is below third centile, we can take it as faltering growth. Or initially the child was, for example, on this 50th centile line. Here you are plotting the weight against the month. Slowly the child was growing along the 50th centile line, and slowly you notice that the growth is falling down to the third centile. Then also we can consider it as faltering growth. That is what? Dropping 2 major centiles over a period of time. So when you note faltering growth in a child, you have to take a detailed patient and family history. The first and most important is you have to take a detailed feeding history. The type of feed, the amount and the frequency of feeding, any feeding difficulties. You have to observe the child during mealtime if possible. You have to observe how the parents are interacting with the child. If there is any difficulty in the oral motor skills, you have to ask a detailed family history regarding any growth faltering or early onset diarrhea. You have to also assess the social and emotional context like parental health, support networks, stressors influencing the child's growth, etc. So, after history, we should do appropriate physical examination. Physical examination may be completely normal, or there can be dysmorphic features, heart murmurs, abdominal distension, cleft palate, depending upon whether the child is having any clinical condition or not. What all measurements you will take? You should note down the birth weight and the gestational age, whether the baby was low birth weight, small for gestational age, or the baby was born term or preterm. All these you have to note down. You have to note down the current weight, height or length, head circumference and body mass index. And very importantly, it is not a one-point measurement. It should be measured serially to identify the trends in growth, and should always use standardized growth charts like WHO growth chart. So what are the differential diagnoses in a child with faltering growth? It may be genetic or familial, low growth potential due to familial traits or genetic syndromes. It may be social and environmental, like poor parenting, maternal depression, child abuse. It may be also due to malabsorption states like cystic fibrosis, celiac disease, and inflammatory bowel disease, or chronic disorders like chronic renal, liver, cardiac conditions. What investigations you will do in such a child? If on examination and on history you have found out any specific cause, like for example celiac disease or cystic fibrosis or any cardiac conditions, you have to evaluate accordingly. And if there is no obvious cause, what investigations you will do? You have to do a blood gas, a stool routine and a stool culture. Urine routine examination should be done, full blood count ESR, renal function and liver function, phosphorus and alkaline phosphatase, that is the bond profile, thyroid function test, serum calcium, serum albumin and celiac screen. These are the basic things to be done in such a child. And how you will manage Management is by regular growth monitoring, dietary support in liaison with a dietitian. You have to address the underlying causes if there are any, and provide the necessary social support. That's all. Thank you and happy learning.